Hello, everyone, and thank you for joining us for the Mobility in Healthcare webcast. I am Kristen Hinsberger, the Senior Programs and Events Manager for ESET North America. Please note this is a live presentation. It is being recorded and will be available following the conclusion of the webcast on demand. If you have any questions for the presenters, please submit them through the Bright Talk question tab at the top, and we will address them during the Q&A sessions. At this time, I'd like to introduce our presenter, Lissa Myers, Security Researcher at ESET. Lissa began her tenure in malware research labs in the weeks before the Melissa virus outbreak. She has watched both the malware landscape and the security technologies used to prevent threats grow and change dramatically. Because keeping up with all this change can be difficult for even the most tech-savvy users, Lissa enjoys explaining security issues in an approachable manner for companies and consumers alike. Lissa, welcome. Thanks for being with us today.
Thank you, Kristen. Hello and welcome, everyone. Today I'm going to talk about mobility in healthcare, what to look forward to, and how to do it safely. Quick introduction, my contact details. My name is Lissa Myers, and I'm a security researcher for ESET. If you have any questions after the presentation, you can email me at lissa.myers@eset.com, or you can follow me on Twitter at Lissa Myers. So let's see what's on the agenda for today. As usual, the obvious thing to do is to start with the definition of what mobile health, or also known as mHealth, is, and how and why people are so excited about it. The first thing most of us are going to want to know is how we might want to use it, and part of that might be best explained by how other people are using mobile devices to improve their health practices and services. And as I can never resist an opportunity to talk about ways to improve your security, we'll talk about how you can best use mHealth safely. This includes both the data that patients and doctors are entering into mobile devices and the devices themselves. This is sort of an exciting agenda for me because we usually start by focusing on what can go terribly, terribly wrong and then show you how to do it right. Today I'll tell you about what's so cool about mHealth and then how you can do it right. There are a lot of things that we could discuss in the area of mobile health, some of which gets outside of the area of security, and some of it is simply too new and too unknown. So I won't be giving you picks and pans of specific devices or apps because they change too often and the field is still relatively new. I know it can be frustrating trying to pick the most secure gadgets when so much seems to change from one software update or hardware upgrade to the next. While I will give you some thoughts to consider, I'll leave reviews to the experts on the fitness side of things for the time being. The advice I'll give you is mostly intended for smartphones and tablets, and with general security practices that should help regardless of your choice. And lastly, I'm not going to give you horror stories about why you should be too scared of this new, changing, and unknown field. The fact of the matter is, it's already happening, and there's little point in trying to shove the metaphorical toothpaste back into the tube now. Better, you should use what's coming safely. And health is, very basically, transmitting or storing health information on mobile devices. So that could be storing lists of the foods that you eat on a daily basis, or your list of exercises, or that could be tracking how you feel or your healthcare visits. It could also pertain to apps that teach you health or anatomy-related concepts. And for doctors, it could be a lot of different things relating to patients or public health, or it could provide training as well. One important difference between health at home and health in a hospital is that most of the data generated or transmitted in a hospital setting is covered by HIPAA, which means there are important security and privacy considerations about the data. So there are a lot of different ways that patients can use mHealth for healthcare. You can look up healthcare practitioners, you can book, track, or coordinate appointments. You can talk to your healthcare practitioners like doctors and nurses or dentists or therapists, etc. Or you can track your health and fitness activities. You can track symptoms and markers like sleep or blood work or weight or body fat percentage or the results of your exercises. You can also track what treatments you're taking, whether they be prescribed medications or supplements or diet changes. There's a whole movement around this last sort of tracking that's called by a variety of different names like self-quantified self-tracking, auto-analytics, body hacking, self-quantifying, or life logging. The variety of tracking devices is going rapidly up and the cost is going down. And people can track almost anything about themselves, and this can not only help people improve the outcomes and progress of diseases, but it can help you improve the state of your health. Certainly, they can provide a wealth of information for you and your healthcare provider. Likewise, there are a ton of different ways that doctors are using mHealth too. On a macro level, they can track a lot of the things about what's going on with the state of public health. They can give and receive information about outbreaks, everything from ordinary events like monitoring the spread of the yearly flu season to the latest information on the current Ebola outbreak. And they can also track information and how it affects patients. For example, how many people are they seeing in respiratory complaints on poor air quality days? And mobile health can be a great boon for communication too. In the aftermath of something like a natural disaster or political upheaval, mobile devices can be a source of quick information about what's going on. Like, for instance, what health concerns are there in the wake of a tsunami, or where are residents or hospital patients being evacuated? Finally, mobile health can greatly expand doctors' reach into areas that are traditionally underserved. There are whole regions of the world that are poorly represented when it comes to medicine, and telemedicine can help reach those people. I was just reading something this morning as well about how EMTs are using telemedicine to help prevent unnecessary ER visits. Developing countries are currently populated with a whole lot more mobile devices than traditional computers, so having apps that are accessible to mobile devices is essential. Likewise, rural areas, even in more developed countries, tend to be underserved by hospitals, medical facilities. So having access to a doctor via computer can mean the difference between life and death when the nearest hospital is hours away. Now, after the previous two slides, a lot of the potential benefits may seem pretty self-evident. When everyone has better access to data, that helps solve medical riddles faster. And when communication is improved, that helps speed up solutions too. And there's sort of a hurdle about all that. Most of us are in the model of, if it ain't broke, don't fix it when it comes to our health. So how do we get people out of that mindset? Well, that's a lot of what health apps are about. How do we motivate people to be proactive about their health? Well, you make it into a game, or you make it into a party. You want to run but find it totally boring? Well, make it into a make-believe zombie evasion scenario, or make it a competition to beat your friends. The thing about this, that the more we are proactive about our health, fitness, and tracking, the more that we can decrease the cost of healthcare. Those doctor visits to investigate mysterious symptoms start to rack up. If you can go into your doctor just once with a whole raft of data, you can potentially save a whole lot of extra visits. While doctors generally aren't going to be using zombies to motivate them to improve care, they can benefit quite a bit from the move to more mobile health too. They can see a wider geographic area of patients more quickly and more efficiently. And if they need to keep track of a patient's whereabouts within a hospital, they can do that too. They can potentially get better patient involvement when it's easier for patients to track their conditions and communicate with their doctor. Speeding things up naturally improves productivity, which decreases costs, and that in turn makes it easier for patients to come in before things get really bad. And aside from all that increased efficiency, mobile devices can give healthcare providers better access to education and training. What's more easy than spending your morning train ride reading about the latest research in your field? So, question number one, I'll turn this one over to Kristen.
All right, great. So you can answer this at any time, but question number one is, have you ever used a healthcare app? Answer A, yes, and I liked it. Answer B, yes, but I'm not a fan. Answer C, no way, why bother? Answer D, not yet, but soon. And answer E, I don't know. Again, I'm going to give everyone some time to answer that question. And again, have you ever used a healthcare app? A, yes, and I liked it. B, yes, but I'm not a fan. C, no way, why bother? D, not yet, but soon. And E, I don't know. All right, we'll give everyone about 30 more seconds.
It looks like some interesting results. It sounds like a fair number of people have tried it and kind of some negative reactions towards the health apps. Some people not a fan. Some people say, why bother? I always enjoy the I don't know responses because sometimes these can be very confusing. Like, is it really a health app?
All right, great. Thank you all for your input.
Great. And now that your head's full of all the ways that mobile health is awesome and amazing and it's going to change the world so we're all tracking every ounce of spit we generate, how can we do that without advertising that information to everyone in the world? I don't know about you, but I don't really care to inform the world how many pounds I could stand to lose. So what should you do to keep relevant data private except for those people that you want to share data with? First, you need to begin by making some decisions. As you begin tracking data, you'll want to give some consideration to what you're collecting and how comfortable you are with people knowing it. Keep in mind, some information may affect your insurance rates. Self-tracking is a fairly new field, and the rules are changing a lot right now about who can do what with which kind of data. And this will vary from country to country. There are rules in the U.S. about how genetics data can and cannot be used by insurance companies or employers. But those rules are not the same everywhere else in the world. So you'll want to treat certain data differently than others. In some cases, you may be happy to share the data. For instance, did you go on an especially long bike ride today? Go you. In some cases, you may want to be very security-minded and encrypt the data so that only you and a select few people can see that information. And you'll want to decide who should be on that short list. Like just one doctor or a few? Or do your next of kin need to know? Would you want to share that information with a research organization? And these are important things to consider. Once you've figured out the answers to these questions, you can make more informed decisions about what apps and what devices you'll want to use. There are some security and privacy considerations that most people may not think about, so in black and white, they can seem pretty obvious. Perhaps most surprisingly, HIPAA doesn't cover all aspects of healthcare information. That social app where you've entered your height and your weight and all sorts of personally identifying info, well, it's probably not covered by HIPAA, and that's not the only information that's not covered. And obviously, mobile devices are small. They can fall out of your purse or get nabbed, or they can get left in taxis. And most people are more concerned with ease of use than with security, so they tend to be pretty easy picking for data thieves. And if that lost phone has no passcode, or if you install apps that leak data like a sieve, your data is pretty much out of your hands. And because HIPAA and cloud computing are both fairly new, there's a lot that still needs to be hashed out. So HIPAA certainly covers the bulk of stuff that happens in your doctor's office, but there's a lot of health stuff that happens when you exit the hospital. Like that info that you put in the health tracking app is not covered, generally speaking. Anything that you use Google or other search engines to find about health information, not covered. Medical-related social networks, so like if you're a member of a Facebook group or a forum for a specific health condition, that's not covered either. Any health product purchase you make, either online or at a retail store, also not covered. If you get health magazines, those are fair game too. Marketers and occasionally researchers can gather or purchase this information from organizations that collect it. Sometimes that can be for your benefit, ostensibly. You can get discounts or you could be contacted to participate in the study, for example. But you need to be aware of this and make the decision consciously. And we touched on this briefly before, and it's pretty self-explanatory. Mobile devices are small and easily lost or lifted. But once someone has access to your device, it's pretty much game over for security. There are things you can do to mitigate that, and we'll go over that in more detail later. Leaky apps is a tricky one. How do you know when an app is leaky? Well, you kind of don't. You can Google apps and see if people have discovered things about them, but that's not really conclusive, especially as updates happen. Generally, you can consider apps that display ads are going to be a whole lot more leaky on average than ones that don't. And hopefully apps from your healthcare provider would be less leaky. If data is encrypted, that's a good sign. And if there's no encryption, operate under the assumption that your data could well be leaked and decide whether you're okay with that. And lastly, most people think of mobile devices more like toys, than real computers. But that's a huge mistake. Mobile devices are in need of protection too. The more these mobile devices become like our personal computers, the more they'll contain just as much valuable data. Now here's a bit that's more centered around healthcare practitioners who need to be more aware of HIPAA requirements. And one of the ways that many people make data more accessible these days, especially with mobile devices, is by using cloud computing. This way data is available not just to one computer, but on all your devices. But to do this, you need to put your data in someone else's hands. In this case, that's your patient's data. And because this is valuable information to cyber criminals, because there are very real penalties for losing the data, you need to take extra precautions. There are providers that say they're HIPAA compliant, but that doesn't necessarily mean the same thing from one cloud provider to the next. It's a good idea to get a more thorough explanation of what this entails. Is the data encrypted? Does the cloud provider have access to the data and to the key? Or should just the encrypted data and not the key? Do you need to have a business associate agreement with this particular cloud provider? And this last one's a question that's not super straightforward and something you may need to investigate from a legal perspective. Lastly, are you including data in the cloud in your risk assessment, both from an availability perspective as well as a security perspective? It's not something to enter into blindly, but to be researched more thoughtfully. As you've been listening carefully so far, you may have a pretty good idea of what's coming next. Yes, protection is needed to make sure your data only goes where you want it to go. There are a lot of ways to do this, and I've already talked about a couple. But it may be a little more tricky to protect the devices themselves because we all know we need to be mindful about our devices and not give them out to strangers, and yet they still get lost and stolen all the time. But there are ways that you can mitigate the pain of losing the device so that your data may not go with it. And now question number 2. I'll turn it over to you, to Christian.
All right, so this is question number 2. Do you have any sort of security enabled for your mobile devices? A, yes. B, no. C, not yet but soon. D, I don't know. Again, do you have any sort of security enabled for your mobile devices? A, yes. B, no. C, not yet but soon. D, I don't know. It looks like we've got some results in there.
Yeah, it looks like a pretty overwhelming yes there. That's kind of awesome. Glad to hear that people are definitely getting the message that there's lots of information on there that people might want to steal, so best to protect it.
Yeah, it looks like 90% of people say yes, definitely they have security, which is great.
Yeah, very cool. And I'm glad there's no I don't know on this one. Okay. All right.
Yeah, exactly.
Moving along. All right. So because there's so many different ways you can make your data safer, let's start there. I know it's sort of a whale of a task to secure your bits and bytes as they fly through the ether. So let's start with one thing at a time. First, and arguably the easiest thing to do, is to improve your authentication hygiene. And secondly, and perhaps most importantly from a security and privacy perspective, is to encrypt your data. Then you may want to be mindful about files and links that you click and download. One you may not think of when you're out and about is whether or not all those Wi-Fi networks your phone is notifying you about are safe to join. It's not just about whether they're password protected. Who else is on that network and who might want to steal your data? And something you may not think about is security related, but makes recovering from incidents much simpler is to back up your data. There are things we can all do to improve our authentication hygiene on a daily basis. The first and most simple is to choose better passwords. One way you can help with this process is to use a password manager. As much as I'm not a big fan of secret questions, as people's answers can frequently be gathered by Googling, there are ways to use secret questions that are better. And perhaps the best thing you can do to improve the security of your online accounts is to enable two-factor authentication on any site where it's available. When it comes to passwords, longer is definitely better. The longer your password, the longer it would take to crack or guess if an attacker were to grab a password database in a breach. It might be easier to think of it as a passphrase rather than a password. Come up with a sentence that only you know. It's best not to choose something that's common that you would be able to Google or which is a popular phrase that lots of people would know. You could use a phrase that's similar to a known phrase but change a word or two. and once you have a phrase to work with, you want to mix it up a bit so it's even harder to guess. You can use numbers or punctuation in place of letters, but be aware that if you need to enter the passphrase on your mobile device, it might have a less varied set of characters. So double check before you use a symbol that you can't enter on your phone or your tablet. Choosing a phrase that's specific to you is part of uniqueness, but you want it to be unique between accounts. Don't reuse passwords for your various accounts, and you want it to be something you can remember. You could theoretically just bang away on your keyboard until you have a long random string of characters, but good luck repeating that in the same sequence next time. Lastly, be sure to change your password often. This doesn't necessarily make it harder for someone to get into your account, but it does make it so that if somebody already has access to your account without you knowing, it gives them less time to cause damage. And if all that makes your head spin, there's an app for that. You don't have to worry about memorability if you have a password manager that will take care of that for you. Password managers will also create strong passwords for you too, with lots of options that will allow you to create a password that fits any site's requirements. In the end, the best password is one you don't know. It can help keep you from being fooled into revealing your password or forgetting your password for that online account you use just like once every third year. Okay, secret questions. Well, there are two basic schools of thought. Some people treat secret questions like a second password and choose something totally nonsensical. For instance, what town were you born in? Of course, chestnut, familiar banjo. And that might be a bit hard to remember, but it's definitely going to be very hard to guess, and it's definitely unique. The other school of thought is to choose the secret questions themselves more thoughtfully. Generally speaking, most sites will have at least a couple good questions. So like a good password, you want your answer to be something that's unique, strong, and memorable. But you also want something that pertains to your life events so you can easily remember it. And choose something definitive, again, so you can remember it. Like, if your favorite color is gray one day and burgundy the next, that would be a bad choice because it's not definitive. Lastly, it should be something that no one, or at least very few people, know about you. Nothing that they could guess or nothing that they could Google, nothing they could trick your kids into telling. There are a heck of a lot of popular sites and services these days that are offering some form of two-factor authentication, and that number is growing on a daily basis. This could be in the form of a one-time key that could be sent to your email or phone, or it could be some form of software or hardware token. Most of the online sites and services these days are using the former, which means they'll send the key to your mobile device or to an email account. So if you have the option, sending it to your phone is a much better way to go, as an attacker could also have remotely hacked your email account without you knowing, especially if you use the same username and password on that account. Adding two-factor authentication is usually pretty quick, and you may only need to use that second factor periodically, such as if you're logging from an unusual location or a different device. It's a little hurdle for you to go about your daily business with that extra authentication, but it can make a huge difference in terms of people not being able to hack your account. Now here's a suggestion that's essential for both home and in the hospital. Home users could protect their data on their own machines by encrypting sensitive files on disk and whenever they send them outside their machine. You could decide what sensitive means to you, but generally that means at least things with your personally identifying information, including social security numbers, financial data, and sensitive health data. Healthcare practitioners can improve protection of their clients' data too. Any data a customer gives you, regardless of how mundane it seems to you, needs to be protected. Anytime it's in rest on your machine or in motion on the network, that means anytime it's not directly in use, it should be encrypted. That also means not sending it in clear text like an email or SMS. The aftermath of the eBay breach that included customers' email and physical addresses, among other things, gives us a really clear picture of that. We've recently done a couple webcasts that go into more detail on how doctors can protect patient data that you can go back and listen to if you want a more in-depth view. And one recent webcast was specifically on authentication, and there's a whole section on how people protecting their customer or client data should be vaulting and hashing users' passwords so you never even have to store them on disk at all. And when I say scan all the things, I mean it in more senses than just using anti-malware scanners, though especially on Android in particular, that's becoming more and more important as more malware is being found on that platform. I mean scanning in the sense of stopping and using common sense to decide whether to do something. So set your device only to install apps from known app stores for starters. And even then, be mindful of what reviews say. Do they say that the app is bogus, or does it have privacy concerns, or do like only 10 people review it? Look for frequently updated apps that are well and often rated. And if you're on an OS which allows an anti-malware scanner, you can scan files before opening or installing them. And regardless of what OS you're on, be careful about things that look odd, particularly strange links and attachments. If something looks fishy, or if a message asks you to go to a vendor's website and enter your credentials, that's generally bad news. If something is really important, you should be able to verify that information through the vendor's website or through their support contacts. Better take a couple minutes to check rather than to deal with the pain of lost credentials or malware. Wi-Fi is as ever-present as air in most places. We have it at home, we have it at work, and in most public places. And most of us have our phones set to notify us whenever it's available for us to use. But from a security perspective, using Wi-Fi is not a very good idea if you're out in public. You really have no way of knowing who else is on the network with you or what their agenda is. It's better, whenever possible, just to use your cellular data network. Certainly you should try to avoid using Wi-Fi to do things that are sensitive, like logging into your work or financial accounts, for instance. And if you do need to use Wi-Fi to log into a sensitive account, there are ways to make it more secure. First, if you can find Wi-Fi that uses a password to log in, that will limit the number of people who are on the network a little bit. That's still not really enough, but it's still a good first step. Second step is to make sure the websites you're using use HTTPS. And so look for that little lock in the URL bar. And it's better still to log in via a VPN, which is a virtual private network. And that creates a private tunnel between you and whatever resources you're using. A lot of workplaces, particularly in the health field, are starting to implement these so that the doctors and healthcare practitioners can more safely access their work resources when they're out and about. I'm sure a lot of you listening to this will have heard of CryptoLocker or other ransomware. The idea is the bad guys will lock up your data and then release the keys once you've paid them a small fee. Well, except there's really not any guarantee that they're going to actually unlock it. They're bad guys after all. So what can you do against this sort of attack? What if I told you it was something that helped you in case you simply lost your phone too? How much would you pay for this amazing technology? And what if I told you it was part of most major operating systems? Yeah, for the nominal fee of no extra money, you can regularly back up your data. You want to back it up 3 ways. Back up your data somewhere off-site, back it up somewhere off your machine, and back your data up in another format. So you can have one backup in the cloud and one backup on a hard disk that's off your machine, and one, say, to a disk that's kept somewhere away from your machine, like a thumb drive in a safe deposit box or at your grandma's house in another city in a safe. Whatever works for you. That way, if your house burns in a fire, you'll have at least one option to restore from. Or if your whole city floods, you'll still have one option. And because it's important to say, those backups should be encrypted so that if someone steals that disk or breaks into your cloud account, they can't steal your data. And question number 3. Take it away, Kristen.
All right, so question number 3. Do you use health or fitness tracking devices? A, yes. B, no, who needs more nagging anyways? C, not yet, I'm considering it. D, I don't know. Give everyone some time. Again, do you use health or fitness tracking devices? Yes, I love it and it motivates me. B, no, who needs someone to nag me or some app to nag me? C, not yet and I'm considering it. D, I don't know. I'll give everyone some time to answer.
It looks like a lot of people are concerned with the nag factor.
I don't know. I personally think it motivates me.
Yeah, the Black Hat and DEF CON conferences were last week, and I was seeing all these people posting their Fitbit stats of how many steps they walked. It was very compelling.
I bet it was like 15 miles.
Yeah, seriously. There's a lot of territory to cover. we get a little bit more broad now. We get one person who's considering it and one person who doesn't know. Anyway, onward. Okay, now that we've gone over what you can do to protect your data, let's look at what we can do with our devices. First thing you can do to protect access or protect against loss is to limit physical access. That's pretty obvious, but you can also limit virtual access to your devices too, especially because sometimes you can't limit physical access as much as you might like. There are things you can do before a device is lost to mitigate possible damage. Finder apps are potentially helpful in locating lost devices, but more importantly, they can remotely wipe data from devices that are out of your hands. It might not seem like it would be helpful for preventing unauthorized access, but updating your software, especially OS software, can be very helpful. And it's also important to put a short timeout on your devices so that it goes to lock screen before too long. There's a fancy thing called the principle of least privilege, which basically means you should limit people's ability to use your device or to access information if they don't need that access. So does everyone using your device need administrative rights on the device? Yeah, almost never. So you set up different profiles, and if you know other people will be using those machines. And you may want to set up different profiles for home and work if you use the device for both, so data gets a bit more segmented. And you can even set up a guest or a dummy account so that if someone does steal your phone, they'll be sent to a walled-off area where they'll have to work harder to get your juicy data. And this will at least give you more time to wipe your data from your phone. You should definitely be putting a passcode or a biometric lock on your phone, like a fingerprint scan. But if you can physically lock your phone up too, so much the better. If you have a locked drawer or a safe where you can keep the phone when it's not in use, leaving it in your car, it really isn't the best idea because the car itself could get broken into. But it's marginally better to lock it up somewhere in the car that it can't be seen, like in a glove compartment or in the trunk. Certainly don't leave it on the seat, even if it's in a bag or a purse. And it's best to carry your device in a way that doesn't necessarily advertise the contents of your bag. Now, laptop sleeves or bags branded with your computer vendor's logo aren't very sly about what's inside. So stick with something a bit more multi-purpose. Plenty of bags these days offer laptop sections that are padded so the devices won't get banged up in transit. If you install a Finder app, or if it's part of the OS that you've enabled before the device goes missing, you might have more options. In some cases, you may be able to track the device or send the information about it to law enforcement to get help getting it back. But much more importantly, most Finder apps will allow you to remotely wipe the device. I would say if you do discover your device has been lost or stolen, particularly if it's been stolen, your first instinct should be to wipe it. Do not press go. Do not collect $200 and wipe it. And if you're regularly backing up your data from your phone, this should be a total non-issue event. Okay, the device is gone. It's kind of a bummer and a potential inconvenience, but your data is a big part of what makes that phone useful. You should be able to get that data from the backup and get right back up and running. Another thing you might not think of in terms of mitigating the pain of loss or theft is updating your software. It seems like every few months there's another trick someone has found to get past the lock screen on mobile devices to get at people's data. But right on the heels of each of those discoveries is a fix from the operating system vendor. By updating your software as quickly as possible, you minimize that window of vulnerability. The odds are the average pickpocket's not going to know the secret trick to unlock these things anyway, but it just improves your odds of them not knowing if you have the latest version of the software. Not to mention, each new operating system upgrade usually has some nifty new security functionality that will help you control your privacy or help keep thieves from being able to use stolen devices. And then the short timeout for devices. The upshot is this. If you accidentally leave your device on a table while you're in the bathroom, if it turns itself off after a minute or so, if it's unattended, that means there's less opportunity for a thief to come up and swipe it and get your data before it locks up. If it doesn't lock itself after being unattended for like 5 or 10 minutes, it could theoretically be sitting there unlocked the whole time you're away. That's no good. And before we go, let's touch for a moment on the Internet of Fitness devices. It seems like you can't find a cat video on the Internet these days without seeing some discussion of the hot new wearable device of the moment, watches, bands, what have you. And most of these have not had a lot of thought about security concerns in the rush to get that hot new thing out to market. I expect at some point soon we're going to be hearing a lot about how these devices are leaky or prone to security problems. This is the case of a log of your latest runs. Most people aren't going to be all that concerned about leaks. In the case of medical devices, we're already starting to hear bad news about security, and the bad news is potentially lethal. And most of the devices don't have any ability to log data for forensics analysis. I'm not saying you should avoid these devices, but I am saying you should give serious thought about whether the absence of security considerations should worry you. If you're the former Vice President of the U.S., foregoing an internet-connected pacemaker is a good idea. If you're worried about someone knowing the route you run every day, maybe you should skip that internet-connected fitness band. But if the data you collected doesn't include GPS, and if you don't care if someone knows you ate an extra 300 calories a day, knock yourself out. Then since that was kind of a lot of ground to cover, let's run through it all one more time. Mobile health is kind of amazing, and people are rushing to start taking advantage of this hot new area. There's a lot that people can do with it, and a lot of benefits to be had in terms of improving health and improving costs, for both patients and for healthcare practitioners. And because it's a new area, there are a lot of unknowns. Are the devices secure? Are apps leaky? Is this HIPAA compliant? Whether you're a patient or in a healthcare practice, you need to protect both data and devices. There are a whole lot of ways you can make your data less tempting and less available to would-be thieves. And lastly, there are a lot of areas in which a good long think can help you. Whether it's about whether to put data in the cloud or to get that cool new fitness tracker, or whether it's to install that new app or to get an internet-enabled medical device, give it a few minutes of consideration before rushing in. There may be ways to make your choices safer. Thank you all for listening. And if you have any questions, you can email me at lissa.myers@eset.com. And if you would like to read more from myself and the other ESET researchers, you can check out the We Live Security blog. With that, I'll turn it back over to you, Kristen.
Great, Lissa. Thank you. That was a lot of great information, and it does look like we've got some questions in there. But first of all, I'd like to remind the audience that if they do have any additional questions, they can enter them into the BrightTalk screen for the Q&A session. And if you'd like to take a closer look at your security future, you can request one of the following in this next polling question. You can request access to the Passmark Competitive Analysis Report. You can request a free business edition trial of ESET software, which includes a remote administrator. And you can request to subscribe to our monthly global threat report, which shares security articles, the top 10 threats from the previous month, and how to deal with them. Please feel free to answer at any point during the remainder of the webcast. And right now, we're going to jump to some questions from our audience. Lissa, it looks like we got some questions in there. So why don't we go ahead and go to some of those?
Okay, let's see. The first one says, do you still recommend password managers with yesterday's LastPass outage? So if you're not aware of that, the LastPass is one of the various password manager options out there, and it's a fairly popular one. They had an outage yesterday, and the reason it was noteworthy is because it was such a rare event. I mean, there's obviously the possibility of having all your eggs in one basket, and that could potentially be difficult if you have the password manager create all your passwords for you. So my recommendation for that would be still to use password managers, but use more caution. So if you have accounts that you really, really need to be able to get at, you might want to create passwords on your own for those, and for things like, newspaper sites or game sites or things that, or Facebook, some things that you wouldn't necessarily need to get into in emergency situations, have the password manager create those for you. So, if you are locked out for a couple hours, it's not a big deal. And, okay, second one, what about encrypted SMS and email? The email question is particularly timely because Yahoo and Google have just announced that they're going to do end-to-end encryption, which basically means that they will allow you to create keys and send emails, so they never actually have access to that information. And especially in light of the Snowden things from last year, I think those are going to be very popular, and certainly for doctors and healthcare practitioners, that's going to be a useful trend. Whether or not you actually use Yahoo and Google, I doubt that most doctors are going to be using that for patient data. But yeah, anytime you have the option of using end-to-end encryption, that's always a good thing, especially if you're sending sensitive data. And SMS, I've heard that there are encrypted SMS apps, and they're incredibly popular, especially for healthcare practitioners, because texting is a really, really fast and easy way to send information. And if you're sending it by traditional SMS, that is really insecure and violating HIPAA like crazy. So the SMS, I think, my understanding is it's not strictly speaking SMS, it's more like an IM, but the cool thing about that is it gives you a lot more features as far as being able to attach files and whatnot and so forth. So it's not strictly speaking SMS, so just keep in mind when you're using your phone, SMS is in the clear. Anything that you would not want somebody else to be able to read, don't send it that way. Send it via those encrypted messaging profiles or apps instead. It looks like there's a lot of questions about the presentation slides. The webcast will be available again after we finish this. And Christian, do you have any? What's the usual protocol for that?
Oh, yeah. So the webcast will be available on demand, so you can go back and look at it at any time. If you did want the actual slides, feel free to just email Lissa directly, and she can get those to you. And I think we had her contact information up at the beginning of the webcast, so you can see it there. All right, great. Well, thank you for all your information, Lissa. I think that looks like all of our questions. And thank you all for your participation in today's webcast. We hope you found it valuable. As a reminder, you can rate this webcast or share it through your social media channels in your Bright Talk window. And for more information on ESET endpoint security products, you can go to ESET.com. Thank you, and that concludes our webcast for today.